I'm Lisa Allred. I'm a program manager in the work life department. And today I am delighted to be joined by Dr. Shushrusha Arjyal. She's the owner and CEO of Bliss Sleep and Psychiatry in Morrisville. She's a board certified psychiatrist and a sleep specialist. Formerly, she was assistant professor at Duke University Hospital. She completed her residency in Berkshire Medical Center in Massachusetts and her fellowship at Wake Forest University in Winston-Salem, North Carolina. Welcome. How are you
Thank you.
doing today?
Thank you. Thank you, Lisa, for having me and making time on this Friday afternoon.
Yeah,
I'm doing fine. Thank you. I hope you are.
I am. Yeah, wonderful. And I'm so excited to be talking to you about sleep. I know I mentioned when you and I met the first time, I just finished a 20-hour training on cognitive behavioral therapy for insomnia. And so I'm all in my sleep mode and ready to geek out over sleep with you today.
That's awesome. I'm here.
Yeah. So let's get going. Let's start with a general question. Why does sleep matter?
So, sleep matters because sleep is one of the most fundamental necessities of life. Sleep is vital to our mental health, sleep is vital to our physical health. There are a certain number of complications or disorders that could occur if you don't get enough sleep, and not getting enough sleep for whatever reason, right? We'll talk more about that perhaps later, but for whatever reason can affect different systems in our human body. For example, if someone is constantly sleeping, let's say less than adequate number of hours for months, what will happen is their memory starts to deteriorate. You know, and the cognitive decline happens, meaning the people are not as sharp as they should be at the given age, right?
Yeah,
And there has been studies where early onset dementia can happen if people are persistently sleep deprived. So that's the memory part of it. Then you look at the like physical aspect of it, right? A consistently sleep deprived person is very sleepy the next day.
yeah,
you know and that could lead to a number of things, like it could affect childcare, it could affect their self-care, it could affect their functionality at work, it could affect the driving skills. They can be sleepy while driving, and so there are a number of aspects, right? And I mean, Lisa, like if we talk about, there are so many things that can go wrong if you don't sleep well,
mm,
including your heart, including your, like, I mean, we have studies where people can die of cardiovascular diseases, or it
yeah,
can get worse and worse if you don't sleep well. Having said that, though, I always say, like, talk about this when I'm talking about sufficient sleep, is we don't want to worry about not sleeping so much that we don't sleep.
yes,
You see?
exactly. Yeah, yeah, yeah. hmm Well, and so the saying "I'll sleep when I'm dead" is really gonna hurry that process along, huh? If you decide not to sleep because you don't want to miss anything.
Yeah, yeah, absolutely. And also, see, there is something called psychophysiologic insomnia, meaning the more anxious we are about our sleep, ironically, it drives the sleep away. So that's not helping, but
Right.
I hopefully will be able to talk about what will be helpful also.
Absolutely. Yeah, we'll definitely get to that because I really want to hear about it. So what is adequate sleep?
So we have to go to the guidelines when we talk about adequate sleep. First of all, what I would like to say to people is, if it makes you feel rested, that is the adequate number of hours for you. Okay,
Okay.
first and foremost, because it does vary a little bit. But if we go to American Academy of Sleep Medicine guidelines, right, an infant would need about 14 to 17 hours of sleep, you know and as we grow old, we need less sleep,
Mm-hmm.
you know but as an adult, 7 hours is minimum. 7 hours or more. So seven
Yeah.
to 9 hours is what we, say it's minimum. But then there is a small percentage, very, very small percentage of population who can go by sleeping 5 hours a night, you know.
Mm-hmm.
And then there is this small percentage of populations, slightly larger than the short sleepers, but they need longer hours, you know.
Mm-hmm.
So in some ways, if you wake up, you feel rested, that's what you need.
So that's telling you that that's your body's kind of set point.
Correct, correct.
Yeah.
And I mean, if we have to follow the rules, then I'd go by 7 to 9 hours for an adult.
Yeah. Yeah. Because the outliers exist, but they're not that common. So we can assume that most of us as adults listening to this need 7 to 9.
That's correct.
Yeah. Wonderful. So why aren't people getting adequate sleep? What are some common reasons?
Life.
Exactly. Yeah.
you know I mean, there are so many reasons, right? I mean, why people don't get adequate sleep. First of all, if I have to just say, pick from something very simple, would be people don't have sufficient time to sleep,
Yeah.
perhaps allocated for sleep.
Hmm.
Be it because of your work, people are working long hours, or they are traveling so much, they are going through different time zones, which leads to shift work disorder eventually. Again, that's a separate, sort of,
Yeah.
and it takes a toll on your physical and mental health, for sure. We call it like jet lag, right?
Yeah.
That kind of thing. Then people have, so many different things. For example, I get moms who have child, caregiving responsibilities for the child, and then they lose sleep. And then down the road, how insomnia perpetuates itself is the kid goes to college and the mom is still not sleeping.
Right. Yeah. Yeah.
you know
No, I get it. Yeah.
Yeah, so you need a small, like, those could be like few reasons. The other reasons could be if people have untreated sleep disorders. Like,
Hmm.
for example, people know a lot about insomnia, right? People have persistent difficulty in initiating sleep, maintaining sleep, meaning they are, struggling to fall asleep, stay asleep, and have never gone to a sleep specialist. They don't know what's going on, right?
Right.
People snore heavily, they have been not sleeping properly, or not getting restful sleep for years. Also, very interestingly, it also matters. I feel like it's kind of like couples therapy, that
Mm.
if the partner snores heavily, there is a chance that the bed partner develops insomnia, because
Yeah.
they cannot, sleep.
Hmm.
So see, those could be few reasons, but then also we want to kind of emphasize on untreated, because I'm a psychiatrist, right?
Yeah.
So untreated, like, mental illnesses can also lead to poor sleep, and vice versa that way. Like, poor sleep can make your depression worse, like anxiety worse, your bipolar disorder worse, schizophrenia worse. But also people with depression, anxiety can have poor sleep, especially if the psychiatric illnesses are untreated. And then there are, people with medical issues. For example, people can't sleep because of chronic pain,
Yeah.
you know so that is, and chronic pain is, Lisa, such a, in some ways, if they are treated with, let's just say, like pain medications, and adequately treated, even then there are certain number of pain medications which can make people sleepy during the day. And
Right.
if they are very sleepy during the day, they won't sleep at night. So
Right.
that affects, right? And it's a very sad state, but like, and hopefully, like, we'll find ways to treat pain in a different ways, right? So that could be, there are people who have to get up and urinate so frequently with different disorders, urological problems. They
Right.
don't get sleep. So several reasons. And then we can talk a little bit more about, like, how, and then comes the poor decision making also, right?
Right. Yeah.
How we don't really emphasize on healthy sleep, so to speak.
Yeah. Well, I mean, I feel like, this 20-minute recording, we could go on for hours and hours. I want to dive in a little bit to, um, the folks that aren't getting adequate sleep for a huge variety of issues, how do they know whether to start with their primary care doctor, start with a therapist who's trained in cognitive behavioral therapy for insomnia, start with a psychiatrist, go to a sleep clinic. Like if you're hearing this, recognizing that, hey, I might be one of those people that has, this is not normal sleep. What do I do? Where do I go?
So you could go to your primary care physician, but what I keep, and I taught residents and fellows also, and what I keep telling people is nothing beats a good history, you
Yes.
know. So getting your appointment with the sleep specialist might be the key to finding out what exactly is going on, because there are so many aspects of not sleeping well, right? It is not just poor sleep hygiene. It's not just don't drink caffeine or don't drink excessive alcohol and don't smoke and go to bed on time and wake up on time.
Right.
I feel like people are very aware of these now because of internet and because of, people read.
Yeah.
People read and they are aware, but just for us telling them like, okay, you should do this is not going to help, you know.
Right.
So we have to dig deeper, like what's going on, what else is going on, right? So I would suggest, if you feel like you're struggling with sleep, please get an appointment with a sleep specialist. It might not have to be like 2 years of follow up, it
Right.
might be
Yeah.
just like few visits to see what is going on, teasing apart what the diagnosis is to begin with. And then comes the treatment, like you mentioned, the treatment could be, before even the treatment, there could be a necessity to kind of get a sleep study, to get
Yeah.
ecography. There are ways where we can find out if the patient has sleep apnea, if the patient is acting out in their dreams, if the patient is snoring heavily, or if the patient actually has just sleep onset insomnia. you know so once we figure that out, and then suppose, like, to answer your question, if a patient has just sleep onset insomnia, has no underlying disorders, we've ruled out everything, cognitive behavioral therapy for insomnia is the best treatment for that. you know but having said that, given the patients, and each individual is so different, you know given the situation, we might have to use medications for a short period of time. That could
Hmm.
be or a combination of that. And then, if the patient has some other sleep disorders, not just insomnia, then the treatment varies according to the disorder, which perhaps is a huge, discussion down the road, probably. Yeah.
Yeah, well, that's really helpful. Um, I feel like we focus so much, and it makes sense, like focusing on sleep hygiene for education and, giving people tools that they can use is really important. However, it may not be enough if you have a sleep disorder, right? So you may
Correct.
be trying to do all of these sleep hygiene things, getting frustrated because you're not making any progress. But the
Correct.
sleep hygiene is really, it's not going to cure what's going on, right? Is that right?
Correct. Yes.
Yes.
Because it can sometimes actually be invalidating to that person,
Right.
you
Yeah.
know because if someone is really struggling with depression and anxiety, and if we tell them, don't be anxious, just go to bed like at 10 o'clock and wake up at, they'd be like, I know that.
Right. Yeah. Don't you
I
think I would do that if I could do that?
exactly. So it
Yeah.
might be, so see, and the education is extremely important, but what I'm saying is, at this day and age, people are extremely well informed.
Yes. Hmm.
So we'll have to find a way to find the individual struggles within that,
Yeah.
and then see what we can do. You see?
Yeah, yeah. Well, and I love the importance of getting a history and, collecting data, because that is the only way, for a doctor, for a therapist, for anybody to help sort through what's really going on is by getting a really good history and getting a thorough understanding of what's happening.
Correct. Correct.
Yeah.
Because there are so many other sleep disorders that we even as a medical student, or I didn't know of. And as I'm diving deeper and I did my fellowship, then I knew, oh, it is a whole world out there that
Yeah.
we haven't, I hadn't explored, at least. Yeah.
Yeah. Well, and we do a lot of wellness programming and stuff on sleep and here at FAST, which is wonderful, I think.
That.
But I'm so glad to have this because one of the things after I did the training that I became not concerned about, but wanting to be mindful of is to make sure people knew when to reach out for help and that sleep hygiene is not the end all be all.
No, no, no. It is not. And also, getting a consultation does not mean like a long-term follow-up. It
Right.
does not necessarily mean you have to be on sleep medications. It
Right.
does not necessarily mean, a lot of other things, like, because, like, I'll tell you, Lisa, right? So see, there is such wide range of sleep disorder. For example, there is insomnia, and there are people who like to go to bed late and wake up late. They don't have insomnia. What they have is called delayed sleep phase syndrome.
Yeah.
They'd be like, and I've written countless of letters in the sense like, this person has a delayed sleep phase. They don't need medication. What they need is a little bit of work flexibility, sort of,
Yeah,
you know
exactly. Yeah, yeah.
that. And then there are people who are walking in their sleep, talking in their sleep. You will be surprised, people acting out in their dreams, like people trying to fish, in their dreams,
Right.
and actually swinging at their partner. So it's a wide range of problems, and this is just the sleep part I'm talking about.
Mhm.
The correlated psychiatric issue, which
Right.
kind of develops over time or can lead to the sleep issues. It's a whole different world again to explore, and see how, where the person stands really.
Yeah, yeah, that's, yeah, and I agree, it's fascinating, and it's so interesting, and it's so important. So while we're kind of already talking about sleep hygiene and sleep disorders, so what's the difference between this kind of inadequate sleep or poor sleep hygiene and an actual sleep disorder? I've already kind of asked the question of who you see
Yeah.
when you're concerned about it, but are there any like, um, sometimes you can find like a checklist. If you say yes to five out of these seven things, then you may have a sleep disorder or something. I mean, I don't even know if something like that exists, but are there any signs that we should be looking for that would tell us that it may be more of an issue of a disorder than just poor sleep hygiene?
Yeah, so first and foremost, what we'd have to kind of make sure is that person has adequate number of hours to sleep. That's the
Okay.
most important, right? Like I mentioned, poor sleep hygiene is sort of straightforward in the sense, if someone is drinking like 5 cups of coffee a day, you
Right.
know, if someone is staying in bed all day and expecting to sleep at night, because that is
Right.
not going to happen. I
Yeah.
saying on my, in one of these presentations to someone, kind of like gave me a feedback that they really liked it. uh, See, a good night's sleep starts in the morning.
Yes.
you know
Yes.
we have to remember that. If we don't exercise at all, if we don't eat healthy, and again, I don't mean it in any kind of judgmental way, right?
No,
people
no.
people
Everybody's doing the
Yeah.
best they can.
Yeah,
Yeah.
they can, exactly. But if someone takes a heavy meal, let's just say right before bedtime, right? Or if someone, suppose, like, drinks excessive alcohol
Yeah.
or smokes, because the withdrawal is so much, right? Nicotine has such a short half-life. There is absolutely a sleep disruption because of that.
Yeah.
The same goes with excessive alcohol, because it kind of disrupts your sleep, right?
Yeah.
Fragments your sleep. So these are very straightforward sleep hygiene, you know, things that people could work on, if they can, really.
That's great.
There could be deeper issues too, right? So.
Yeah, yeah. So, like the heavy snoring, would that be a signal that you would want somebody to at least run it past their doctor and make sure there's nothing going on?
So the things that I would ask people to really go for, some kind of like professional help
Uh-huh.
would be Number one, in a very vague way, please listen to your body.
Yeah.
you know if your thing is saying, like, if you are feeling something is not right, something is absolutely not right, you know then to look at objective signs. Yeah, if someone is snoring heavily, if the primary care physician tells that you are on two blood pressure medications but your hypertension is not controlled, sleep
Okay.
apnea could be because of that. If your heart disease is worsening, if you had a family who snored heavily but never really gotten any help, that would be the time. If you are driving, you had adequate number of hours of sleep at night but you're still sleepy, you have to pull over multiple times, please see a sleep specialist before you get into an accident, right? If you're acting out in the dreams, if you're punching, kicking, if you, as an adult, even one incident of walking in your sleep, sleep talking not so much because it is more common, but if
Okay.
someone gets up and starts eating and does not remember, we call that sleep related eating disorder.
Mm,
you know those would be some things like that, I would say. Absolutely see a sleep specialist. Then there are diseases of sleepiness, excessive sleepiness. If people like fall asleep like this in a fraction of second, that's
right.
narcolepsy, could be narcolepsy, right? Or could be other diseases of like excessive sleepiness during the day. So those would be some things that you would see a sleep specialist for. The other thing, like, so other than like proper, if if you're drinking 15 cups of tea and then
Right.
you
Yeah.
can reduce it, I would say at least a primary care physician's visit, and then if necessary sleep specialist visit is important, really.
Yeah, that's wonderful. And this is such good information. I feel like my brain's just buzzing with all of the different tangents we can go off on.
Yeah,
But because this is Teach Me in 20,
sure, sure, no
our
worries.
goal
Yeah, yeah.
is to stay. But this is amazing. So, is there anything that you thought of while we were talking that you wanted to say that we didn't get to?
Yeah, I think, for me, like personally, every patient is an individual, you know. So first of all, if you have any symptoms, please validate yourself. Please don't think that, just because someone else is saying, okay, you should have done this, because, a lot of times people want to be healthy. People
Yeah.
want to do good, follow good sleep hygiene and do well for themselves physically and mentally. So yeah, please validate yourself. Don't think and don't feel that you're alone in this. I mean, sleep disorders are extremely common, and so are psychiatric disorders, and the most important thing is they are treatable.
Yeah.
you
Yeah,
know
exactly. You don't have to suffer, and you don't have to
exactly,
suffer alone. There are people that can help you. And I feel
exactly.
like if there's one message that I feel so strongly about getting out there in these Teach Me in 20s, it's that is you're not alone, and there
Exactly.
is help available.
Yes, exactly. And as we are learning more, there is more awareness, of course, right? But yeah, we will have to take that first step for
Ex-
sure.
Exactly. Well, thank you so much.
Just thank you
Tell
for
I'll
having me. Yeah.
I'll include it in the blog, but tell folks how to get in touch with you if they are interested in scheduling an appointment or doing some sort of consultation follow up to this.
Yeah, thank you. So I have virtual clinic and I also have in-person clinic in Morrisville. You could make an appointment directly by calling the number or going to the website and scheduling an appointment. You could also email me. It's a secured email and I can help you schedule that. My team is there. So many different ways that you could reach out and
Wonderful.
schedule an appointment. And again, like, it doesn't have to be it can be a follow-up, it can be a consultation, so we'll take it like one step at a time.
Perfect. And I'll include all of that contact information in the blog so nobody has to worry about finding it. And I just want to,
Thank
again, it's
you.
been such a pleasure. Thank you so much for doing this with me today.
It's great being here, Lisa. Thank you, and please thank your team as well. I'm very happy that I could be here today.
Yes, us too.
Thank you.